So I was a open developer from 2011 till the end of 2013, and so right then as a postdoc it really benefited me because I got funding, which gives you a little bit of independence, and you can choose your own path. But also later on, it really helps with the next stage. So if you're going to set up your own lab, or even if you move into biotech, having your own funding gives you that extra bit of thing on your CV that just helps in a very competitive environment. But beyond that, also the Hope Fund is really in a community of individuals, so it's also great for networking. Just having, I have shown my poster during a Hope Fund event to a Nobel Prize laureate, so that's a very special thing to do, and it just creates those first connections, and those really help you later on with the next steps. So both senior researchers, also people in industry, but also young people just like me at the same stage that later go on to set up their own labs, and so you meet them for the first time. And so a number of people that I met during Hope Funds I still know and engage with, and so it just makes you part of a community. So the methodology of research is the same across all the places I have been. It's just, I would say, the energy and excitement around it is different. And one of the things that attracted me to the East Coast, and I've been there, I went away, but I came back. So it's just the level of excitement. People are excited. There's a lot of energy around it, and that helps me to just keep going and be excited about my day-to-day research. So I work on the area of metabolism. I've worked for a long time in cancer metabolism. So the idea is that cancer cells, for them to proliferate and to grow, they need a lot of energy, and they use metabolic pathways that is a little bit different from normal cells. And so we try to learn how we can target those to treat and prevent cancer cells from growing. I also moved to the field of immune cell metabolism, which we're studying very similar pathways. Idea is very similar as well. Immune cells, when they become active, they need to proliferate, they need to grow, they need to carry out their function, and it also carries with that also means that they are very metabolically active, and also, of course, there's a lot of interest in immunology in cancer, and so we are also very close to that in that sense. So by manipulating immune cells and by controlling how active or inactive they are, that also has a lot of implications for cancer research as well. So we look at what pathways are very active in these cells, and we're especially interested in pathways that are very unique to immune cells, or that are more active in immune cells. And then we try to ramp that down, and that's in the case of autoimmunity. In the case of cancer, it's the other way around. You want to kind of ramp up immune cells and make them more active. And there are cases where if you hit certain metabolic pathways, you can actually make them more active, and that is also something we're very interested in. Certainly, therapies are becoming more targeted, and I think that's needed, and that's a very good development. I also think that we're starting to learn how we can look at other cell types. So for example, immune cells, we're kind of using our own cells in our own body to make them more active to fight off the cancer cells. And so we're also learning how to use our own cells that are already there to make them more potent as well. There's a lot of experimentation, so we're doing a lot of screening. So there's a lot of technological development in in being able to hit specific genes, and then we look how that changes an immune cell function, and that's we can screen hundreds to thousands of genes. So it's figuring out what is the right conditions, what is the right experiment to do this in. But the technology to do this has become very powerful. I'm still relatively young, but even in my relatively short career, I've seen a lot of developments happening, and it just becomes faster and faster. Science is a big component. I think when we talk about science are crucial for discoveries, and beyond that there's a long trajectory from the initial discovery to an actual drug that helps the patient. And that is also part science, going from the discovery to a treatment, but there's a lot of art as well. It takes a village to develop a drug, and so there's a lot of communication, making sure that we all go in the same direction. So it's way beyond science in that regard. I've been involved in quite a few collaborations. During my postdoc, I was involved in a pancreatic cancer, a large collaboration. From there on, I've also worked with another young PI, and she was or still is in Portland, Oregon, and we published a paper earlier this year. So that's been a multi-year collaboration. So collaborations are very important. I think they're becoming more and more important. Biology is much more and more technology driven. It becomes more complex, and just knowing everything is just not really how it works anymore. So you just need to collaborate. You get more done if you do that. You look for people that are very, they want to discuss their data, they want to hand over their data. If it's a good collaboration, you share your data, and you both bring something to the table. You both have something unique you can add to a project. I think there will be a lot of progress. So the targeted therapies, for one, are an example where I think we'll make much more progress. I think with the immune therapies that are currently happening, I think there will also be more understanding of the complexities of a tumor microenvironment. A tumor is not just a bunch of cancer cells. There's a lot of other cells, immune cells, but also other supporting cells, and we're starting to learn more and more how the cancer cells can actually hijack or interfere with normal interactions and actually make interactions that are to their advantage. And I think those complexities we're starting to learn more about as well. And I think those are 3 areas, in my opinion at least, will lead to more advances. Sometimes we can actually combine certain drugs, and that is something I think in academic environments is very important to do as well. Looking at oftentimes certain metabolism, if you hit one pathway, a cancer cell over time might find a way to kind of circumvent that and do its thing without being interfered. But if you hit them with 2 drugs, then you have more effect. So currently you have the research going on, that's more of an academic endeavor as in universities. Then you have, beyond that, if something is interesting, you have pharma companies, pharmaceutical companies that will start to develop that. What you see more recently is that you have biotech companies that are more willing to take risks compared to big pharmaceutical companies, and they have the specialty of taking initial discoveries or even making their own discoveries and then bringing that forward. So it's a specialized process of doing that. For academic research, NIH, for example, is a big one here in the US. So that's government funded, but that's not nearly enough. And so there's also a lot of private funding organizations, and Hope Funds is also one of those. One is that the Hope Fund specifically funds very difficult to treat cancers. And what I've seen also is that in addition to that, they are willing to fund projects that are a little bit more out there. They're a little bit more risky, and they might not be funded by other organizations. But the Hope Fund is willing to take that risk and that step to fund that, because if it works, you make a bigger advance. Typically, if you submit a proposal, then you'll have to show a lot of pieces of data to show that what you're proposing that you will do will actually work. And so there's already quite a burden to show data, like to say this will work, and then you'll be funded. So there's already a lot of work you've done to get there. And more risky proposals that don't necessarily have a lot of data to support that proposal tend not to get funded by many organizations, whereas the Hope Fund is willing to take that risk. There's definitely a need to be able to have an organization to fund that kind of research. China definitely does research. I'm not sure how good that research is. I think they are publishing a lot. I think the quality is maybe something else. I would say the US definitely has a very good academic research environment, and also beyond that, there's a lot of keenness to make sure that whatever we find, we can also make a drug from, right? So you actually get to a treatment, and being able to fund that and support that as well. Beyond that, Western Europe, of course, has a lot of research going on as well. But I think there's a difference in the amount of risk that people would like to take here to actually support drug development.